My name is Antonina Shkrobyak. I'm the first year student of Bogomolets National Medical University, and today I'll present my project Virtuality and its use in medicine. So my supervisors are the PhD in pedagogical science Yehorenkov Anatoly Ivanovich and Pashenkov Victoria Vasilina. In my project, I have the few following questions. What is the virtuality and what are the methods of creation? How we can use the virtual reality in medical education and treatment. Also, what are the possible risks for the patient? And what are the future perspectives, advantages and disadvantages of virtual reality in medicine? So during the report, we'll follow the following plan. We'll give the definition to the word virtual reality. We'll tell how it was presented in literature. Also, we'll classify the virtuality, we'll tell about the methods of creation and the main components of it. Also, we'll tell how we can and where we can use the virtuality, and we'll start in a medicine field. We'll tell about the medical education and the practical medicine with some examples from the different medical fields. Also, we'll tell about the advantages and disadvantages and give the conclusion. So, what is the virtual reality? Virtual reality is an illusion of the reality created with the help of a computer system that provides visual, sound, and other sensation. We can tell that the ideal virtual reality should interact with all the system of organs of existence, hearing, sight, taste, touch, and smell. It's not really a problem today with the sight and the hearing and also the smell and the touch, but it's still quite a problem for the virtual reality system to interact with our taste. So we can trace many references to virtual reality in the work of science fiction writers, and the great example is the Ray Bradbury. He wrote a lot about virtual reality, and we can see some examples of the virtual reality rooms in his books. So let's go to the classification. For a better understanding of the subject of the work, consider the classification of the virtual reality system. The first one is the full immersive virtual. It's non-immersive virtual reality. This technology provides an engineered computing environment, but allows user to be aware of and control of their physical environment. Non-immersive virtual reality system consists of the computer or the display and some devices such as keyboard, mouse, and joysticks. A video game is a quite great example of non-immersive virtual reality. The next one is a semi-immersive virtual reality. Semi-immersive virtual reality experience provides user with a particularly virtual environment. They will still make user feel like they are in a different reality when they focus on the digital image, but it also will allow users to stay connected to their physical surrounding. The great example is virtual reality rooms. Fully immersive virtual reality, the last one, as a simulation, gives user the most realistic simulation experience with visual and sound. In order to experience and interact with fully immersive virtual reality, user needs to the proper virtual glasses. It's called the head-mounted display, and also allows you to track your own movements in real time. So it's a great example where we had this head-mounted display. It can be games, it can be virtual excursions, and another experience. So, depending on the methods of implementing virtual reality, we can distinguish the following types of virtual reality. The first one is based on a simulation of reality. The simulation-based virtual reality systems involves a computer simulation of some approximate simulation of the real environment or the situation, dangerous or something. Educating is one of the most popular simulation-based virtual reality application. It can be used for the teaching drivers and pilots, and so you can drive or fly an aircraft. The next one is based on avatar, another type of the virtual reality system is the avatar-based virtual reality, and we should know that the avatar is a graphical representation of person. Avatar-based virtual reality allows the user to generate their own graphical performance, to choose appearance, and it will be male or female character, and also you can be present virtually in a conference or in another meeting in real time. The next one is a display base So it's just using displays, 3D virtual world on a display device such as desktop or display. Examples are the first-person video games where the player performs certain actions. And the next one is based on a projector. The image is just projected on the walls, floor of the room, or it can be 3D projection. The great example is the virtual reality rooms. So, virtual reality is a certain system that contains elements. Also, what are the main elements? What are the main parts of the virtual reality? The first one is the virtual world. Virtual reality uses computer technology to create a virtual environment that reproduces the stimuli or the physical world and allow the user to interact with it in real time. The simulation allows them to feel that they are part of this virtual world. The next one is immersion. So with virtual reality, headset and surround sounds, user can fully immerse themselves into the virtual world while playing the games or watching something. The next one, really important, is sensory feedback. Reproducing the principle of human perception, virtual reality provides a space in which the user can move or track his movement on the screen and change position with the help of the virtual reality equipment. Sometimes it's more than audio and video. It also plays with some senses, as we said, like taste, smell, and provides movement in environment to provide an immersive experience. And the last one is the interactivity. Real-time on-screen interaction provides a sense of connection and immersion between the user and the virtual reality system through touch technology. For example, the user can kill a monster, shout, or push, or select something on the screen, like in real time. We will see it clearly, an example of the surgeons. So we have defined that the virtual reality is with the help of which methods and technologies created. So it's time to learn how it's used. The first is education. So it can be the simulation of complex or dangerous activities. For example, driving a vehicle or the surgical operation. What are we interested in? So such technologies allow students who are allowed to demonstrate and apply the theory even during the class. Science is the realization of the internal structures of object, molecular and atomic structures, in particular in medicine, which will be discussed later. Design, it can be construction and editing of three-dimensional models, mechanisms, structures. We can design models of apartment and institutions. Entertainment, when all of us know about the virtual tours, excursion, and video games with the effect of immersion. And military sphere, it's really interesting because we can use it for the training of pilots, drivers, operators, and also some trainings with dangerous weapons. So, let's tell about medicine. I will take two parts. It's medicine education and practical medicine. So let's stop in education. Since virtual reality can be used in education, it's especially suitable for the training of doctors because virtual 3D models allow you to see an anatomically accurate organ from the outside and from the inside to study the structures and the function of systems in more detail, and also the practical skills of students. It will be completely impossible and unethical on the life, people in real life. So let's talk about the practical medicine. Virtual reality technologies are used to train the practical skills of doctors, prepare them for the procedure, and elevate the condition of patients. So the great example is surgery, because virtual reality capabilities allow surgeons to prepare for operation, because based on a CT or MRI and angiography image, doctors can create an accurate model of their affected area. For example, it's possible to prevent and reduce risk when removing tumors or have another surgical operations. The great example is also the dentistry, because in dental practice, virtual reality can be used to prepare staff for operations and training, or to elevate the condition of patients, especially kids. Gynecology. Already in Kiev maternity hospitals, they began to apply the practice of using virtual reality during the childbirthing. So during the childbirthing, relaxing music plays in headphones, and the woman watches some lens spaces. and keep calm. And also there are some researchers that we can use the virtual technologies as a part of childbirth preparation, because it will tell about some exercise and breathing and other stuff that will help to relax a woman. Technologies of virtual reality in psychotherapy are used in the treatment of depressive and anxious disorders. They also help in the fight against the addictions and the post-traumatic stress disorder. And some clinic in Kiev also offer similar services as psychotherapy sessions. And I want to stop on a real interesting thing. It's art therapy. Art therapy should be signed out, and one of the techniques that use virtual reality in psychotherapeutic practice. Virtual reality in art therapy allows patients to independently create a space in which they can feel safety and find themselves among the images of their own creation. One of the techniques of therapy is body mapping. So in this case, the patient is asked to depict any sensation on a graphic image of their own body. Therapists can use the similar techniques in treatment of post-traumatic stress disorder, phobias, and anxiety. So let's talk about the advantages. The following are amount of advantages of using virtual reality. Advanced flexibility and customization options of virtual reality allow us to create any necessary environment according to any specific goals. Next one, offer users to work in a controlled environment. It's another really important advantage that used for treatment if the patient remain in a safety environment under the supervision of doctors. The therapy can be stopped when the patient feels any discomfort or the vital signs begin to change for the worse. Also, the next one, it provides detailed 3D images. Virtual reality is often used to create 3D models for accurate and illustrative renderings that are more advanced than conventional 2D scans. And its psychological impact. It's hard to compete with the virtual reality in terms of impact on patients' minds. No other technology can make patients perceive artificial words as real through the signs of hearing. Okay. Also, the using of virtual reality technologies has a number of some disadvantages. They are practical, technical, and ethical. So, let's talk about technical disadvantages. First, it's a high cost of hardware and software. Most implementation of the virtual reality in medicine involve complex hardware and complex computer programs to induce a believable experience, and it's really so expensive that not really any clinic or university can allow them to buy this. Lack of extensive testing in usage history. The development, implementation, and approval of new treatments take considerable time and must follow in a strict procedure. As technologies related to virtual and reality are still in the stage of intense development, they often do not have a proper trial run, and the use is considered experimental. Does not provide sufficient preparation. It's really hard to compare real life practice and the virtual reality practice as good at it, but real life is still better. So, among the ethical issues of using virtual reality in medicine, we have the following. It's insufficient awareness of the consequences of using impact of the human body. We don't really know about all effects and all the influence because it's still experimental techniques, and it's not enough research. So we can have some issues as addiction. Gaming addiction has already become a widely recognized problem, and possibility of the virtual reality addiction is also considered for the doctors. The risk is particularly high for the patient with dementia, who has difficulty recognizing and interacting with the real world. Also, the risk group is the patient with severe disabilities, because they may prefer to escape into a virtual world. And according to some studies, children talk about the virtual experience as if they were in real. Indicates an easy influence on children's perception of the world with the help of these technologies. So it has a lot of ethical questions. Is it okay? Is it not dangerous? Is it right to use this technology for the kids? Also, it may confuse users. One of the known drawbacks of the virtual reality devices, they can cause nausea, dizziness, disorientation, or similar symptoms in some users. In general, patients may be more susceptible to such effects due to their medical condition, so it should have more experiments, more researches, but this sickness, it's called the cyber sickness, when you feel sick from all these technologies. And also the interesting problem is desensitization. Some studies indicate that after spending a significant amount of time playing computer games or virtual reality games that contain sense of violence, the users become desensitized and have a great risk of remaining indifferent to violence in real life, or even they can take part in some violence because they have increased level of arousal and aggression. So, having considered the main points regarding virtual reality and its use in medicine, we can draw the following conclusions. That virtual reality really have great perspectives for the use in medical education and medical practice. So in medical education, there is like no question, it's totally good, but for the practice, it has a lot of things that are good, but it still should have more researches because there are a lot of number of advantages and disadvantages. It requires further research to ensure quality treatment and safety of patients and improve the quality of life. So, in the course of our further work on a project, we will create an educational case for the medical student about the using virtual reality in medicine and medical education. And also, we have plans to visit the clinic that use virtual reality technologies in psychotherapy to treat post-traumatic stress disorder. So, our future science work will have the analysis of literature about the using virtual reality in post-traumatic stress disorder, and also visit the clinic. So thank you for listening my project.